Pelvic organ prolapse is a condition that refers to the bulging or the herniation of one or more pelvic organs into or out of the vagina. It could be related to prolapse of the uterus, the bladder, the bowel, or just the vaginal tissues. Pelvic organ prolapse occurs when the fascia, the ligaments, or the muscles which support these organs become weak and damaged, primarily following childbirth or as an effect of aging and other chronic factors such as being overweight, chronic straining with constipation, chronic weight lifting, or chronic coughing. In most cases, prolapse of a mild or moderate degree has mild or even no symptoms and does not appear to carry additional risks. In cases of severe prolapse, when, for example, the bladder is protruding through the vaginal opening, there are risks of voiding dysfunction of the urinary tract with high volumes of urine retained even after passing urine, with risks of urinary tract infections, which in some severe cases may result in pyelonephritis or sepsis, with risks of hydronephrosis, which is uncommon, but it could be a complication of severe prolapse of the bladder, and in some other cases by just a friction of the vaginal tissues against clothes and the underwear of the women, ulceration and vaginal infections may be seen in these cases. The diagnosis of pelvic organ prolapse is clinical and is based on clinical examination, whereby a woman is asked to strain or to produce what we call a Valsalva maneuver in order to observe the maximum descent of the pelvic organs during the clinical examination. Usually women present to our clinics when there are bothersome symptoms or when there is an incidental finding during a routine examination, for example, during a cervical smear. By diagnosing this condition, we can offer, first of all, reassurance, as many women are worried that when they see a bulge or they feel a bulge protruding through the vaginal opening. And we can also give advice about measures to prevent further worsening of the prolapse or treatments. One of the options is to just monitor the symptoms and not take any specific actions for treating the prolapse, especially in mild cases. But it is important to maintain healthy pelvic floor muscles by pelvic floor muscle exercises in order to prevent further worsening of the prolapse, also to avoid risk factors such as heavy weight lifting or exercises with weights, chronic constipation and straining, being overweight. These risk factors can make prolapse worse. Also, we can advise women about the treatment options, which range from conservative to surgical treatments. The most common treatment options for pelvic organ prolapse include pelvic floor exercises, vaginal pessaries, such as ring pessaries or other types of pessaries, which are devices that are inserted into the vagina and support the prolapsing pelvic organs. The surgical treatment options include vaginal, abdominal, laparoscopic, and in some cases even robotic procedures that will correct the anatomical defects resulting in prolapse. Surgery is considered necessary in cases of severe prolapse, when the function of the pelvic organs is affected, such as urinary tract function, when there is a severe bladder prolapse, for example, when there is a chronic ulceration and infections of the vaginal epithelium, when the symptoms are particularly bothersome and women have a significantly affected quality of life, and of course, other functional disorders could include difficulty in emptying bowels, as well as sexual dysfunction.